Hey everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is Dr. Kameron Matthews, the Chief Health Officer at Cityblock Health. How's
Hi,
it going?
Jared. Thank you for having me.
Excited. You're like a celebrity in the social world, and we'll get into this, but I'll just share a quick story. I'm walking around the health conference. All of a sudden, your face is staring at me from around the corner, but you know it wasn't you. It was your face on the side of the LinkedIn booth,
I
which
was
is so
there, but
cool.
I wasn't there, right?
Yeah.
Yeah.
Yeah, it's they needed to put a QR code so everyone could have followed you direct just from that too, huh?
I thought they had one. I was hoping
Oh,
to get a
actually,
few
maybe
more
they did.
followers.
Yeah, maybe they did. I don't know.
Yeah.
I just as soon as I saw it, I took a picture and sent it to you. And I'll have to check that again. They probably did have something like that,
They
but
got it. It makes no sense that they wouldn't. They're pretty big on making sure their followers are following the right people.
but how cool is that? That's trivia for someone in the future, right? Like how many people had their faces on a health booth?
I wish I
Probably
was
two.
there for that very reason to take a picture next to it with people. Like, yeah. Yeah,
Well,
now LinkedIn has been a pretty amazing platform, so I'm proud to have them highlight what I do and how clinicians like me can actually have a voice on that. I love it.
and I'm excited. We're going to spend some time today of you kind of digging into, having a LinkedIn presence and things like that. But for our audience right now, I would love if you could just give them a quick background about you, and then we'll talk a little bit about Cityblock Health and what you're doing there, and then we'll dig in.
Great. Yeah. Well, again, thank you for having me. I am a family doc at the base of it. I'm a proud second generation family doc. Even that, I learned a lot from my dad. But I really ended up turning my career towards a now wide range of different vulnerable communities as opposed to just a typical private practice or like a lot of my friends going to academia. I've otherwise really been interested in helping those communities that are perhaps underserved, vulnerable. I started off in correctional medicine, of all places, actually at Cook County Jail on the west side of Chicago. Still my absolute most enriching clinical environment to practice in. Then I went to a couple of federally qualified health centers in Chicago. Then I transitioned to the VA, where I was part of the national leadership and rose up the ranks to being Assistant Undersecretary of Health for Clinical Services, which means CMO of the whole health system. And then in 22, I transitioned over to Cityblock. So my path has been pretty phenomenal, from an opportunity in leadership, in policy circles. I've had a really good time, actually. I'll say it like that.
I love that. And what was that transition like? And I guess two parts to it. What was that transition like, and maybe what would be your advice on the back end of the question? What would be some advice for people that also want to make that transition?
Oh, it's a great question. And I actually get it all the time. My transition actually wasn't as chaotic as I actually anticipated it to be, because of I actually see the VA as the integrated health system that it is. It's the nation's largest integrated health system. It is really the epitome of value based care and really driving outcomes for veterans in a whole health philosophy. That care model is exactly what we are seeking to deploy, or a rendition thereof. That's exactly what we're trying to deploy here in Cityblock. So really, I'm taking so many lessons learned from the VA to Cityblock. The transition, of course, from the largest government bureaucracy to a VC backed, a bit more business focused environment has been a learning curve for me, and I absolutely love it. I've actually never been fearful of taking on new challenges, and this to me is just another piece of healthcare that I needed to learn about. Yeah, it's been a learning curve, but now 2 years in, there's still a lot more I need to learn, to be honest. But the transition wasn't that difficult. I was ready for it.
Let's At this point, probably most people know of Cityblock Health.
Mhm.
But let's assume there's some people in the audience. These are my favorite people when we do reach them. Is let's say they haven't heard of Cityblock Health. Give us that overview of what the company looks like today.
Yeah. Yeah. We are a transformative primary care provider. We offer a value based care system where we're taking on full responsibility for a set population of patients. And we offer integrated health services, primary care, behavioral health, as well as social services to just make sure we're focused on the entirety of their well being, the entirety of their healthcare outcomes. This is particularly unique for us, however, because we're also focused primarily on Medicaid populations, Medicaid and dual eligibles, so low income Medicare. This is yet again another marginalized community that unfortunately has a limited uh, set of solutions, to be honest, that have been designed for them, designed for the difficulties that these communities face. And that's really our goal, to prove that there is a care model, that there is even a business model around how to take care of Medicaid populations. We're doing so in the community. We're doing so again with a primary care chassis. And value-based care is definitely at the crux of it, because we're stepping away from the frustrations of the fee-for-service model, and really building care teams based on what our members need as opposed to what can get paid for, which is definitively my experience in primary care, definitely in the FQHC space. I loved that experience, and I believe in FQHCs, federally qualified health centers, wholeheartedly, but they're stymied in their ability to be innovative because of unfortunately their financial model. So Cityblock has really taken that first step to try to prove a new solution, and I'm proud to be a part of that transformation.
Let's talk a little bit about your role in particular, right?
Yeah.
The chief health officer is it's not a new type of role, but we've definitely, I feel like I've heard about people having that role much more over the last, like, let's call it 3 years. Talk us through kind of what that role looks like, and kind of your role within Cityblock Health.
Yeah, I'm actually really proud of the title. At the crux of it, I'm the chief medical officer. So I am the head clinician. I'm responsible for our clinical operations and outcomes, the establishment of our medical practice. But expanding that beyond the somewhat limited definition of medicine, medical, health is a much broader concept. So when we're thinking about the population that we're serving, how we need to earn their trust and engagement, be as tech enabled and data driven as possible, just my scope obviously expands because I'm stepping outside of just the traditional concept of what a doctor is, what a clinician is, and really working with different partners around the organization to make sure that we're achieving, first and foremost, our clinical outcomes, our quality outcomes, in the most efficient manner, but then also, again, so that we're driving the business of the organization as well too. So health is really just a recognition that we're doing so much more than just traditional medicine.
I like that. I bet we start seeing more organizations roll that out than even versus like the chief medical officer, then, because you are
I hope
right.
so.
Yeah.
I hope so. I've heard chief clinical officer out there as well too, and I think it goes more broadly than that, because I'm proud to manage our social care efforts and really think through what it is around food insecurity and housing and transportation and digital access. Those are concepts, again, not traditionally considered part of the clinical space. I'm very comfortable in building our strategy around that. That's what we did in the VA. The VA has more than $1 billion budget on housing alone every year, and I was really proud to be the leader over that organization. So um, I think we as a health system need to recognize that we're providing health and not just medicine. I think definitions matter.
In the beginning of this episode,
Yes.
I talked about how you're a bit of a social star, and LinkedIn, you have that top voice badge. Very few people have that. Even fewer people have it in healthcare,
Yeah.
right?
Yeah.
Let's talk a little bit about something near and dear to both of us: the importance of brand building and having a presence, specifically on LinkedIn, but also even
Mhm.
more broadly than that. You've done a really great job of that. I know it's not easy; it takes
Yeah.
time.
Yeah.
Um, I guess what tips and tricks, what advice do you have for people? And again, kudos to you for reaching that accomplishment.
Thank you. Yeah, no, I I am so grateful to many individuals at LinkedIn, including one of their executive leaders who I went to high school with. He was the first one that said, "Don't you want to do a little bit more on LinkedIn?" I was not present on the platform at all. And he reached out to me and connected me with their creator management team. And yeah, in the healthcare space, I have been fortunate enough, if you kind of think back to the journey that I described of the different clinical environments I've been happy to be a part of. I also therefore have many different audiences. So I have a veteran audience. I have a federal government audience. I now have this value-based care audience. I have the FQHC audience. I do a lot of work in diversity of the workforce. I have a huge following there. So I think definitely one of the recommendations is to not think so narrowly about kind of where you want your content to be directed, but that potentially perhaps an opinion, an article that needs to be shared could reach multiple different audiences. So how do you actually engage them? I love that I can really jump from audience to audience, depending on the topic, but also within the same topic.
Yeah, it's you always have a solid post up there. You hit it. You're always either commenting or writing up your
Mhm.
own post or being tagged in someone else's post.
Yeah.
For
Yeah.
this was a good year for you. You had a couple of awards, right?
Mhm. Mhm.
Um,
Of course, your award. I thank you for that. Part of the inaugural class. I was honored. Yeah, no, it's been a great platform for me to have a voice. I did not use it that fully when I was at the VA, just because I needed to be very careful about kind of comments and how they might be attributed to the federal government. And then luckily, being at Cityblock now, my voice is very much aligned with the mission and the direction of the organization. So I have been pretty much unfettered, and I'm getting acknowledgement for it. It's great. I'm trying to use more of their different tools, do more video and the like. But I think the feedback that I get is often that I'm sharing information that often others don't have access to. They're not reading the same sort of journals that I am or the like. I'm sharing opinions that they have, but they're fearful of voicing themselves. I'm getting a lot of gratitude when I meet people, even on the street. Someone in my neighborhood while I was walking the dog stopped me and said, "Oh, you don't know me, but I follow you on LinkedIn in person." So yeah, it's been great. I haven't admittedly done this on other social media. I'm not on X. I mean, no, I'm on X, but I'm not using it frequently. Definitely not doing as
doesn't it
much.
sound like you're on a you're on a drug when you say that though?
I
Like,
know, it's so
I'm
on
not
X.
on X. I don't do X. Right?
I know.
Like,
Maybe that was purposeful. I don't know. But yeah, I'm not on X no matter what version you refer to. Yeah.
yeah.
And I haven't gone all the video route, like the TikToks and all
No,
those other things.
I think LinkedIn does a good job. Like they're not overcomplicating it either. The one I'll have some feedback on. I think with the live stream feature,
Hmm.
I think it's cool. I
Yeah.
don't think it gets enough engagement in the moment, right? Like than other platforms.
Yeah.
You could have right 20,000 followers, but you do a live stream and there's like 10 people, like in the stream.
Gotcha.
Um, which it doesn't necessarily like get people excited. Like when you see 10 people in there, that doesn't mean the content's not good.
That's exciting.
But I do like the part that then you have that video in there where people
Exactly.
can absorb it after, which is kind
Yeah.
of cool. But yeah.
Yeah.
Uh,
We've done one video after a talk that I gave with the co-host, and it was pretty fun. But yeah, I don't think I saw anyone saw it.
yeah, or they did. They just saw it after it
Hmm.
was published on the
Wasn't
platform.
live. Exactly.
For sure.
Yeah.
You are also involved in the nonprofit space. Talk us through that involvement, what that looks like, and how you managed to do that along with everything else.
Yes, it makes me tired kind of thinking about it. But about 10 years ago, my good friend and I founded a nonprofit called the Tour for Diversity in Medicine. And we consider ourselves a grassroots effort where we take around physicians, dentists, and pharmacists of Black and Brown background to meet students where they are, to meet them on college campuses and at high schools around the country. We've been to 27 states over the past 10 years, met thousands of students in person. And so much of the motivation that we provide is because we're sharing our stories. We are sharing the mistakes that we've made. We're giving them advice that perhaps advisors or others that they've been exposed to just aren't willing to share. And we're definitely making a difference. The outcomes that we follow more than anything, because it's just a single day program that we host, are about whether or not they believe that this is an option for them after they've gone through a day with us, and definitively the answer is yes. And also now they believe it's more than just an option for them generally, but individually as a Black or brown student, that they now have seen someone that they have a connection with and that they believe that they could follow. And that's just wonderful. And that's what's necessary. If we're talking about the diversity of the workforce, we're not going to do it just by pushing against the affirmative action case and worry about, admitting more students in the school. We actually need to go much earlier in the pipeline and recruit them and motivate them to apply in the first place. There's not enough. So that's what my nonprofit does.
I think having those connections and build it, like seeing that someone's maybe doing what you want to one day accomplish is so important. Every day, I don't do it as much now, but over the last like 10 years, every day I used to listen to, it was kind of in a mix with some background music. So it wasn't just straight up motivational talks, but I was a big fan of like what Les Brown was talking about.
Yeah. Yeah.
And Les Brown used to talk about like when he was like making money or doing stuff, right? And he would talk about like making $1 million, and he would say like the easiest thing he ever did was make $1 million. The hardest thing was actually believing that it could happen to
There
him.
we go. Yeah.
So like it's that's really what you're helping with, right? Like
Yeah.
you're helping people realize that the path you want to take can actually happen to you. And here's a perfect example of someone that's done it.
That's exactly what we do. And we're not taking those perfect students. In fact, I never like to go on those tours, as we call them, and say, oh, my dad was a doc. I don't want them to see that, right? Because that's the kind of image we don't want to promote. We actually make sure we're finding physicians and dentists that have come from difficult backgrounds. One of them, the story that connects with a lot of students most, she was taken to the emergency room with her father after a gang drive-by in LA, and no one in the emergency room at the time spoke Spanish. So she was translating for her father, and now she's an emergency room physician treating other patients like her father was, right? We've got individuals who've failed the MCAT multiple times, failed out of college multiple times. Advisors told them, you're not good enough, and still made it. So we want these students to see themselves in our mentors, as we call ourselves. So yeah, the motivation is through our stories and through our experiences.
I love it. Yeah,
Yeah.
it's you don't fail unless you stop.
Yeah. Yeah. And so many of our students stop, and there's no one there to encourage them to keep going. I met a first year, I'm talking freshman, young Black man with a 3.9, whose advisor had the nerve to tell him, no, maybe you need to be thinking about another career. Medicine is probably not going to work out for you. A freshman with a 3.9. I don't even understand how that could be voiced to someone. That's what our students are facing. So we're hoping to do our part to combat that.
Yeah, and it's about kind of being that light for them to show them that that's not everyone's opinion. That's a
Yeah,
set individual that who cares,
exactly.
right?
That's what we
Another
say. These people are not your gatekeepers. They're not the ones making these decisions at
what
all.
was the other guy was the football player I used to listen to, Inky Johnson. Do you know
Yes.
him too?
Yes.
Yeah, he used to say like he would go into high school and say like I'm going to be in the pros one day, They're like, "No, you're going to be in cell block D." Like but we need to also stop people from like putting that type of negativity on, especially like adults can you
Yeah.
can weather it. You've heard everything, but that is so for a fragile like
Yes. In
young
our youth.
mind.
Yes.
Awful.
Exactly. Exactly. It's worth than the tracking that you get in like public school, because you're actually, hitting them emotionally, intellectually, and yeah.
Yeah,
Yeah.
uplift them. Don't shoot them down before they even get their
Thank
shot
you.
to try to
Thank you.
flourish. Yeah.
Exactly.
Well, we are heading into the new year.
Yes.
Would love to hear some of your predictions now for what do you think is going to happen in the world of healthcare?
Um, I am eager for a broader conversation around Medicaid and Medicaid policy. I'm excited that North Carolina has finally, expanded Medicaid. I'm hoping that the other 10 states are following along and having those conversations. I think it's an increasing conversation in policy circles, in different organizations that I've connected with, that Medicaid is on a lot of people's radar, whether it's in the VC space or not. And um, I think we need to recognize that this is a specialized area that needs attention, not just the application of other solutions from MA or other or commercial space, but that new solutions need to be created that are tailored and designed for populations of low incomes. So I'm excited for that. I think the conversation is increasing, and I think there's going to be more in 24. With that, I've been a part of a couple of great conversations just around digital health and how, in the same vein, they need to be designed with equity in mind, designed for the communities that we say need them most, but yet aren't at the forefront of the thinking of those designers, founders who are trying to create tools that they say will impact health equity, but they're clearly designing them for a different community. um, I think there is more of a conversation. Again, I've been a part of a couple of them, of really making sure designers, founders are working with the communities that they're hoping to serve from the onset, that they're helping them in the design and potentially even ownership of those eventual tools. I'm excited for that. Those conversations have been increasing.
Dr. Matthews, this has been an absolute pleasure having you on the podcast, chatting, and you are fantastic. I look forward to staying in touch and keep putting out great content on LinkedIn. Love it.
Thanks, Jared. This has been so great. Thanks for letting me talk with you today.